Let's talk about prevention and wellness and social media. I've been working with a site called livestrong.com. That's the most visited health site in the world. I don't know how many people have gone on livestrong.com. You can manage your diet. It's a health and fitness site. A lot of diabetics on it because of this daily plate offering, but they get a huge amount of hits every month. This is Dan Patrick from Demand Media that owns the site.
For Livestrong.com, we're now reaching over 8.5 million people according to ComScore. If you look at the Livestrong eHow Health category, that's number 6 in health.
We met with Dr. Leslie Saxon, who is the head of cardiology at the USC Keck School of Medicine, and sat down and talked to her about what she thought was really important, the things that we needed to cover. It's really given us the opportunity to take a deep dive into these topics that are really important but aren't talked about enough. So raising awareness for our users, and not only raising awareness, but giving them something that they can do afterwards.
What's really inspiring us now and inspiring the team is to keep bringing these incredible things like Health Matters or unique products or the DARES concept where people can learn how to quit smoking and be in a community. It really boils up people achieving these daily victories and being inspired by what Lance once did 12 years ago to what their neighbor down the street did who's in the same group as them.
So basically what this is about is me going to a social media site and saying, let's do a show on sudden death. Let's really cover sudden death credibly from a number of different perspectives, from AEDs to implantables to risk factors to athletics. And let's archive this in a social media site. Let's get it out there. I'll live blog with people, whatever it is. Let's get this information on sudden death out. And that's been an incredibly fruitful relationship that has evolved into a couple of applications. We developed something with a couple of other docs called My Quit Coach, a quit smoking app. The whole purpose of this was to not be judgmental about smoking, and everybody wants to quit, to try to develop something that would allow people to track their cigarette use and to engage their social network. This turned out to be an incredibly popular app for them. It's not judgmental, it's collaborative, 90% success rate, huge amount of people wanting to stay in that social group after they've successfully quit for more than 6 months, like the addiction model, because they want to evangelize and help others. And the fascinating thing about this is we didn't know why it was so successful, so we went back because we had all these users and we queried them. We did a clinical trial on why this thing works, as well as an antidepressant and a nicotine patch, which is the current standard. And the users told us it's the daily tracking, it's the powerful social community, the positive feedback, and it's simple. That's the first time in my knowledge that social media has been used, and then we have studied how it's used and why it's successful. This strikes me as a pretty powerful tool. We're working with BMW to develop a health car. This is a mock-up, they're not adopting this, but we envision putting a defibrillator in the seat. These cars are so sophisticated now that if they sense just a little less tension on the steering wheel and they have cameras, they can autonomously drive the car over to the right of the road. Why not put a defibrillator in there? In the seat to defibrillate the patient as well. I mean, the people paying $80,000 for these cars are middle-aged men to a large extent. They're at risk for that. They can have a good driving experience and they cannot, have sudden death in their car. You can put electrodes on the steering wheel. You can integrate that into an experience. Maybe the health sits in the back. Because if you're paying that kind of money for this kind of performance vehicle, maybe what you want is a really enriched technical driving experience. So you don't have to have your heart rate integrated into that for a health reason. It can tell you how well you're driving, how well you took a curve. Even if you're only going from downtown LA to Santa Monica, you can get that experience. The health can sit in the background and the fun can be with the biometrics. Now I want to talk about something near and dear to us at USC. We're a little football school, a little athletic school, but we have a charity, NFL Charities grant, and we're working with major sports to try to bring this idea of measuring stuff from your body and biostatistics to the playing field, because we think if we can get it into the elite athletic playing field, we can do a lot of good, but we can also get it into the popular culture, because everybody will want to be like Mike. Everybody will want to do this. So we're trying to create a safer playing field. Again, the medicine sort of sits in the background. That's always there because we have the data, but the experience is something else. And we're committed to adding this data to the athletic experience. So let me show you some of the stuff we're doing.
Your goal shouldn't be to buy players. Your goal should be to buy wins.
Who are you?
Here is 25 players that have been overlooked by every other team for one reason or another, like an island of misfit toys. In here is a championship team, one that we can afford.
Who's the kid? The kid is the new assistant GM. We're gonna shake things up. Tell him.
You want me to speak?
We're not pointing you yet. It's the new direction of the Oakland A's. We are card counters at the blackjack table. We're gonna turn the odds on the casino.
You don't put a team together with a computer, Billy.
Adapt to die.
So already in professional baseball, we're tracking some metrics, right? And this is only the beginning. Speed of pitches, types of pitches, but that's literally a bunch of minor league players or pitchers sitting in a back room in a statistical company. New stadiums that are capable of wireless, incredible wireless capability that can be able to collect real-time stats off of players and provide them back to fans, to trainers. So, what does all this mean? That, Moneyball tells the story of Billy Beane and the Oakland A's and just a radical concept that changed the way that we thought about selecting and achieving athletic success. How can we further that type of concept by using biostatistics, not just for health screening and injury prevention and increasing performance, but also for the fans' experience and the athletes' experience and their own knowledge of their own performance. And remember, at that level of play, it doesn't take a whole lot of edge to succeed. The difference in skills are so minute. So we're partnering with a number of sensors, and I show this picture because I want you to know this technology is out there and it's being used. Zephyr technology, Avery Dennison, Corventus. One of the things that's just enormously interesting and frustrating to me is the fact that you'll have a high-end medical patch that, if it was dumbed down a little bit, could be purposed for athletic screening all across the country. It would really scale and be incredibly useful. Yet that, in our current structure, that patch, through its regulatory small CPT code, will never make it to the playing field, in spite of the fact that the investment in that thing has been tremendous. Yet you'll have a disruptive company like Avery Dennison coming out with a similar patch, much cheaper, able to get into the consumer marketplace earlier, and they all do basically the same thing. So what's the difference between me writing a prescription for the thing on the lower right or me telling a patient to just go buy it at Costco? They do the same thing. What is the regulatory issue here? If the stuff is out there and it's ubiquitous, how do you regulate it? I don't know the answer. It's an enormously difficult question, but it's something that we hope to beg forgiveness for and not necessarily ask permission to do. I wrote an essay about this that was picked up by the Times about how biosensors can influence sports and culture. I want to show you something the NFL is doing right now.
When we first conceptualized E39, it was really important to us that we just have this one device.
And so we partnered with Zephyr Technologies because they make this for the U.S. Special Forces and people whose lives depend on the data that they're pulling out. So whether it's U.S. Special Forces in the field or the Chilean miners training to be extracted from the mine, these people's lives depend on it.
Me and Julio actually have a G competition. I'm at 3.9. It's a rumor going around that he hit 4.1. I didn't see it.
It's got to be accurate. It's got to be precise data. And so we're thrilled to have that level of precision in a product that now people can train with and understand exactly what's going on with their body when they're training.
So we're partnering with Zephyr Technology right now at the NFL Combine. This sensor, this Iron Man type sensor that plugs into an Under Armour shirt, can track heart rate, give you a great ECG, respiratory rate, position, GPS, but it can also create a metric for acceleration. So providing a scout with acceleration in the first 10 yards of a potentially, pretty archaic 40-yard dash assessment of an athlete could really make a difference in understanding both athletic capability as well as trying to keep athletes well-trained and out of trouble and understanding where they're successful. This is an iRhythm patch that we put on USC players for a scrimmage game in the Coliseum just to see if, as part of an NFL grant, Sudden death in athletes is an incredible tragedy. These are our most elite individuals, and the extremes of and what they're able to do put them at particular risk. I think of them almost like thoroughbred racehorses. They're the best, but they're delicate in an odd way. And sudden death risk in football may really be specific to certain positions, et cetera, but nobody knows what's normal for these guys. So this is the USC football team, 16 of them, and defense and offensive players. You can't market or, NCAA athletes or whatever, so we had to PowerPoint off all their tattoos. They wouldn't be recognizable because they all have a lot of tattoos. But it was interesting because the athletes really liked this patch. They thought it was their power pack. So this was at the Coliseum, and the players had the patch on, and we were actually able, except for 2 offensive linemen, one of them was pulled off, and we put it back on, and the other one was pulled off again on another player. But otherwise, we had just pristine recordings even during contact. And I don't know what this data means. I don't claim to, but I think it's fantastic, and we're going to create this enormous repository and really understand, I think, at the end of the day, risk, but more importantly, we're going to be able to purpose this, monetize this for all sorts of interesting things. So this is an offensive lineman, and the red circle show where, and the noise on the thing shows where he's made contact, any kind of contact. And I just am writing this data up, and it's interesting, whether it's a running back or it's an offensive lineman, when they make contact, their average heart rates are like 170 to 190. But when they're resting or between plays, they're very different in terms of their heart rate behavior. But at those points of stress, they kind of look alike. Now let's get into gaming and entertainment. So Angry Birds, as I mentioned, I play, I'm kind of addicted to. This is an enormously successful game in our popular culture. 350 million downloads, 2 million plush toys sold. It's selling 1 million of those every month. Why do we have to wait for the killer medical app? Why can't we diabetize Angry Birds? This is the type of interdisciplinary relationship, I think, that is going to be needed to really advance mobile health. We just need to take what we know has stickiness and is popular and use this for kids with diabetes or adults if they get afflicted with diabetes in order to engage them in their care. We developed this heart rate game with a sensor that we have with a Vancouver gaming company called I Heart Jellyfish. So my 8-year-old son plays this. We prototyped it in him. And what you do is you record your heart rate. It's incorporated into the game. And as you move around and as you exercise, you don't get eaten by bigger fish, and your fish's luminescence grows bigger. We think that introducing heart rate and biostats very early on and in gaming will create a generation of patients who are just more connected and smarter. It's like asking your kid to read the New York Times every day. By the time they go to college, they're kind of more, informed. Asking your kid to interact with their biostats. And by the way, if your kid knows this stuff and has these sensors, I think when grandma goes down or something else happens, that kid is part of the solution, as kids can be. We use our children for that now. They tend to be tech savvier. They tend to advance our understanding of technology. We just want to include them in this type of movement. We work with a company called Egamatrix that's incredibly innovative. That thing at the end of an iPhone that sticks in is actually a glucometer. To my understanding, they're the first people who actually got a medical device to stick into the end of the iPhone, and they negotiated that whole process with Apple. They're in the FDA right now. We're using and prototyping that glucometer to create a game for kids, because no matter what you say, yes, this is nice for a child just to be able to use their iPhone, they still have to stick themselves 8 times a day and are ostracized and have to comply with that. A child doesn't realize they're going to get retinopathy in 30 years. They're just worried they're not like their friends. So someone from our film school developed this little blood farm game with characters like Susie L'Amour. So every time a kid checks their blood, they build a blood farm. And they can invite their friends, but they're the cool ones because they're actually using their blood. But they can invite their friends to grow their blood farm. And we think that will help engage and entertain. And by the way, mom can download that and look at the game and understand in a non-kind of interrogational, cop-like way what are kids doing, and improve that relationship to try to enhance compliance and understanding. And you can do that with Angry Birds or Fruit Ninja, and those are the types of things that we think will stick. This is something we're developing that my 13-year-old daughter is helping us test. This is a social game for girls. Teenage girls in particular, drive a lot of social interaction. This allows you to track your heart rate with your friends, or broadcast your heart rate around, or play group games with heart rate. This is a little worrisome. Perfect matches at 170. We don't know what those kids are doing, but it's a game that familiarizes kids and gives them further insight and provides this kind of ubiquitous physiologic data that will probably end up changing medical care. And one of the next generation sensors we want to use for this game is this very innovative technology that is an iPhone case. What does my daughter never leave home without? Her smartphone. So you can literally record an EKG, and I have one here if anybody wants to see it, by holding the electrodes on that case that fits on your iPhone or your Android. This is my ECG. I use this in clinic. I use it at parties. I've gotten my golden retriever's EKG from this. We're doing a study on this right now of people who came to our conference. We just gave them to them. And guess what? I've diagnosed a serious ischemic arrhythmia in Mumbai because one of the guys from Qualcomm gave this to a Nigerian who was having an acute ischemic event. I've diagnosed VT in a device rep who was just having some arrhythmias, actually having ventricular tachycardia. A young guy, if he would have gone to a doctor, his EKG was normal. He looked great. Oh, it's palpitations. That person could be at real risk for sudden death. I think we have to be incredibly humble at what we're going to know and understand as we start to collect massive amounts of this data. A lot of our preconceived notions about these conditions are just not right. So hopefully I've explained to you that we're working in this environment where we're trying to blend medicine with cinema and the creative aspects with engineering and business to understand the viability of some of these ideas, to really kind of integrate these various internet and web technologies over the various screens to advance health, and we're trying to do that through sports and advance health in sports and training, et cetera. So you can see the breadth over wellness, chronic disease in areas that we're working. And as I said, we want to beg for forgiveness later. Some of this technology is just going to beat everybody in the medical space and be out there, and then it's going to catch on. And if it catches on to 13-year-old girls who are just used and think that heart rate is important to their social interaction, suddenly we've got heart rate on 20 million girls. We don't have any kind of data like that. We don't know what 13-year-old girls' heart rate, what insights potentially could we get from that? But that came from a game. Again, the medicine sits behind it, or the prevention sits behind it. So I sort of think it's the same way that iTunes completely disrupted and changed music. That thing, that killer product, that app, that game, maybe that sports use could completely change the way your life or the way medicine is practiced. And so blurring the lines between popular culture and medicine, I hope, is the answer and the solution to many of these problems, and allows us to continue to innovate in high-end chronic disease medicine. And if not, I'm really worried we're going to lose a lot and devolve. And I don't want to be too glib about it. I think this type of stuff has the potential to change major concerns: violence against women and children, hunger, access to clean water, serious conditions that allow, as I said, a cardiologist in LA to diagnose acute ischemia in a Nigerian visiting Mumbai is a very powerful concept. I've been doing this for 25 years. Why should my access only be to the people who come into Los Angeles to see me? That's a crazy waste of the last 20 years of my life, in my view, and I think that we can just do so much of this with technology. We can impact so many more as we all want to do. Thank you very much.